are calls for more visible food labeling for consumers to make informed decisions about what's actually in what we put into our mouths. Well, according to Healthy Living Alliance, unhealthy packaged food without clear information is to blame for life-threatening conditions. Let's talk about this with the campaign's Nzama Mbalati, who's the program manager, in fact, at the Alliance. Nzama, very good afternoon to you. Thank you so much for being on Daytime Update. First things first, how much of a big deal should we be making about the quality of the labeling on our food?
Thank you so much, Tembekile, and good afternoon to the viewers. I think it's very important to not underscore that currently in South Africa we do not know the food we are eating. And a lot has to do with how the packaged food either has misleading information or unclear information that we can easily comprehend at a glance in order to inform consumers in what we purchase. So food with excessive salt, sugar and fat is hidden at the back of the package, which if you have not studied food or you didn't do dietetics at school, it's difficult to comprehend that long list on the back of the package that will say 0.5 gram of sodium and so on. So we are calling for the clear warning labels on the food that is above the threshold of salt, sugar, and fat, which is actually directly linked to the spiral growing of epidemic of diabetes, hypertension, heart disease, and some cancers.
Is it as simple as adding more information about, as you're saying, the thresholds, shall we say, of the sugar or salt input in a product? Or is it also about labeling sugar content as sugar instead of using perhaps another term?
Yes. So yes, that is a very good question, because if you look, there are products that we assume they are healthy. So you can give an example. You get to a shop, you get a yogurt. It's written low on fat, right? But it doesn't say that that yogurt is high on sugar. So we believe labeling will actually assist consumers in products that are having a higher threshold. But over and above, we will know that in tobacco, that regulation and labeling just do help in raising awareness in itself, the package itself. So many people today know the harms of smoking. But if we look on the food, many people are not aware that actually there is a harm in the overconsumption of food with a higher content of sugar, salt, and fat.
Is this, would you say, done deliberately by manufacturers? And how grey is the area around regulation?
So the industry will always manipulate the space when there is poor regulation. So you will know that before tobacco was regulated, there would be even sponsorship for sports in tobacco, right? But when regulation started to be strengthened, we started to see that people couldn't smoke in public spaces, and so on. So the same way that, because we have got overwhelming body of evidence on the link of overconsumption of food or diet with high salt, sugar, and fat, that we can do much more to actually regulate the industries, because the industry voluntarily are not going to demonize their products, right? Because they are in the business, to make profit. So I think it's important that government can play its role, in protecting consumers and protecting our health as people who live in South Africa. And these policies are not just new here. There are many countries similar of socio-economic status like Chile, Brazil, who have actually implemented these policies to actually support consumers to make informed decisions when they purchase packaged food.
That information will only be as effective, right, as it is used and understood. And you have to wonder how many of us actually bother to read the labeling or the contents of every product that we buy.
Very true. So research shows that we basically take seconds when we're purchasing. So you'll understand if you're going to a shop to buy grocery, you have list of items that you want to buy for the household. So most of us, we just check the expiry date, really. And then we're like, okay, then the expiry date is fine. But then if we were to have a label in the front at the first glance, that will say high on salt or high on sugar or high on fat. I mean, at least that would be easier to comprehend. Never mind, the current labeling is that it's not comprehensible or understood by many people and many consumers at the current stage. So I think it is a big deal because regulation do also assist in terms of, improving the food environment. If you look from like the sugar, when sugar tax was implemented, we saw the reformulation away from, high sugar content of sugar sweetened beverages into less sugar or no sugar content. So this is very, very important as well as in terms of improving the food environment, but also raising awareness to the consumers. We know that regulation alone will also need us to continue bringing education to the people, making sure that we educate people. So HEALA, one of the things we have started is to do nutrition literacy with communities so that people can understand the science and the politics of food.
And you are ramping up this campaign that you're on now. I was hearing earlier that there might in fact be TV adverts and the rest of it channeled in that direction. Am I right?
Yes, certainly we are enrolling a huge mass media campaign across various media platforms, again, to raise awareness to consumers, because the food industry is not going to tell us what are the harms unless as citizens we stand up, unless government can make sure that there are laws and policies in place that can empower us, that can protect us, because then we get more vulnerable, particularly in the space of food. People do not know that there are harms in the food that we are eating. Mm-hmm. Hence, HEALA is scaling up the campaign, and we have launched this mass media campaign across different radio platforms. And people can also go into our microsite, is www.whatsinmyfood.org, or go to HEALA website, which is www.heala.org, to actually join many South Africans in signing the petition that demands, the National Department of Health to urgently implement the regulation on the front of pack warning labels.
Nzama Mbalati, good to have your time. Thank you, sir. Artists